This training video is designed to teach patients how to perform the Valsalva maneuver with the Indicor system. The Valsalva is a physiologic maneuver that is designed to create pressure changes in the cardiovascular system that can aid in diagnosis. The maneuver is performed by forcefully exhaling against a closed airway, as if blowing up a balloon or bearing down for a bowel movement. The Indicor test consists of 3 brief 10-second Valsalva efforts, with rest in between. A test usually takes under 5 total minutes. It is an easy test to perform. However, proper technique is important in delivering accurate results. The Indicor system consists of 1. A handheld device into which you perform the maneuver. 2. A disposable mouthpiece. 3. A finger PPG sensor, which measures your pulse response and heart rate. And 4. A computer tablet to guide you through the procedure and display calculated results. You will usually be asked to perform the maneuver sitting upright, slightly reclined, either on a hospital bed, exam table, or chair. In each case, note the following. Do not bend over. Do not cross your legs. You will be guided by the clinician to perform the following steps. The clinician will hand you the Indicor with the disposable mouthpiece attached and the PPG plugged into the base. You may hold the Indicor with either hand. The clinician will place the PPG finger clip on the index finger of the opposite hand, with the wire on top and finger fully inserted. Place your arm with the PPG sensor by your side, ideally with your hand hanging free in the air. It is important to limit movement and not put pressure on the PPG sensor, which can interfere with the signal. The clinician will enter information on the tablet. These items are used along with your Valsalva measurement to calculate your response to the maneuver. The clinician will then position the tablet screen in front of you for comfortable viewing. At this point, we are ready to practice the Valsalva maneuver before starting the timed test. The practice screen allows you to practice the Valsalva maneuver and get feedback from the clinician before the actual recorded test. It consists of a graphical pressure gauge to guide you in keeping your Valsalva pressure in the target zone. To perform the maneuver, simply take a normal breath in and then exhale forcefully into the mouthpiece. The effort should come from your abdomen and again is similar to the sensation of blowing up a balloon or bearing down for a bowel movement. Do not puff your cheeks to exhale. Now practice the Valsalva while watching the screen. Take a normal breath in and then exhale with enough force to keep the ball in the center of the green zone of the pressure gauge, as close to the center line as possible with steady pressure. Keep the hand with the PPG sensor as still as possible. Once you can successfully keep the ball steady in the green zone, you are ready to complete the test. The clinician will press the forward button that starts the testing process. First, the device will check for a stable PPG signal at rest. Refrain from movement or speaking during the measurements. After about 20 seconds, a countdown screen will appear. The screen will count down from 5 seconds, and the screen will transition from gray and white to color. Now, take a normal breath in before you perform your Valsalva. Hold a steady exhalation for 10 seconds, which is indicated on the timer in the upper right-hand corner. The screen will change to gray and white at the end of 10 seconds. Remove the Indicor from your mouth and breathe normally, remembering to limit movement. Between each test, you will have a timed 30-second rest period. Even though you are not doing the Valsalva during this period, it is important to remain still as the sensor is still collecting physiologic data. The timer for the rest period displays on the bottom of the screen. At the end of the rest period, the measurement process starts again, first displaying the signal acquisition screen. Repeat the above process until you have completed the 3 Valsalva measurements. After completing the last Valsalva, remain still until the results screen is displayed. The effort to forcefully breathe out should come from your abdomen. Try to keep your efforts steady for the 10-second test period. Try to keep the arm with the PPG sensor steady and do not apply pressure to the sensor. Try to limit movement and talking, both during the maneuver and throughout the entire testing process.